आज हम बात कर रहे हैं लिम्फेडेमा नाम की एक बीमारी की, जिसे हाथी हाथ और हाथी पांव के नाम से भी जाना जाता है। और ऐसे में यह भी कहा जाता है कि जितनी होगी बेहतर अवेयरनेस, उतनी मिलेगी इस बीमारी से निजात। तो आइए ले चलते हैं और बात करते हैं डॉक्टर अंशुमन मनस्वी से और जानते हैं कि कैसे इजीली क्योर की जा सकती है लिम्फेडेमा नाम की यह बीमारी। हाय, वेलकम टू ट्रू हंट एंड टुडे वी आर टॉकिंग अबाउट अ डिजीज कॉल्ड lymphedema which is not talked often, and today we have got Dr. Anshuman Manaswi who is going to talk about this disease and what are the causes and symptoms of the spreading of this particular disease. Thank you so much, sir, for joining True Hunt.
Thank you, Gaurav.
First question, of course, lymphedema, not talked much about. So, first of all, brief in 2 lines, what is it all about?
Lymphedema, or in common language, we call it as hathi pair, hathi paw, elephantiasis, or hathi hath, is a disease in which there is massive swelling of the upper or the lower limb, leg or hand, which happens due to obstruction of lymphatic system, which is a similar system as that of a vascular system. जैसे कि ब्लड हमारे बॉडी में फ्लो करता है, उसी तरह से एक पाइप्स का नेटवर्क है जिसको लिम्फैटिक्स बोलते हैं, या ग्लैंड्स में जाता है वो, और वहाँ से फिल्टर होके आगे जाकर वो ब्लड वेसल्स में मिलता है। तो ये पाइप्स की चैनल को लिम्फैटिक चैनल्स बोलते हैं। जब उसमें कहीं भी रुकावट होती है, देयर इज अ ब्लॉकेज इन दैट, it causes accumulation of the fluid, and that fluid is called accumulation is called lymphedema.
So, sir, if we talk about the percentage in India, that how much people are suffering, I'm not talking about particular Maharashtra, I'm talking about India, that if we talk about in percentage, how much people are suffering from this disease?
So world over, the estimate, I mean, although it is a little old estimate of WHO, around 250 million people are suffering from filariasis, which is almost around 70 to 80% of the burden of lymphedema. Okay. Filariasis disease. Out of that, India contributes to around 40% of the filariasis burden. That means around 125 to 130 million people. In addition, we have cancers which have been treated. After the treatment of the cancer by radiotherapy and the surgery, when the glands or the lymph nodes are removed, in those cases also the hand or the leg can get swollen, especially in breast cancer and genitourinary cancer. So these are also added. Then there is a huge volume of patients who are suffering from lymphedema in our country.
Sir, of course, as you said, that huge number of patients will be suffering from lymphedema. How much patients you have come across personally with this particular disease till now?
Not only me, I mean, all my doctors, colleagues have somehow seen many patients, and the general public also sees people going around with heavy swollen, especially in the swollen feet, especially in the southern belt, eastern belt, Bihar, UP, Bengal, Andhra Pradesh, Orissa, Tamil Nadu, Kerala to Konkan region. They're all very this thing. I must have seen 500, 600 patients myself during my career. And most of the people avoid such patients because we really didn't have any cure for it. So people used to shunt them, even the doctors, because they didn't have any cure. What to answer them? That we don't have any cure for you. So many different types of treatments evolved. Some mostly to counsel the patient or to tell them to live with it and to maintain the hygiene and all that, but no proper cure was there.
My next question, of course, what are the symptoms? I'm not talking about the cancer part. The cancer hua to uske baad the disease occurred. The journal said symptoms to have this particular disease.
Either ways, the symptoms is the swelling of the leg or hand is the symptom which starts with. And gradually over a period of time, because of repeated infection and some other problems because of accumulation of fluid, it becomes bigger and bigger. And with infection, the skin starts becoming thickened. So it becomes so thick that it resembles the leg of an elephant.
Like you said, hathi paw and hathi hath.
Yes. The initial period when those hard skin do not develop, it is a simple swelling in the leg, and that swelling should not be neglected. Any swelling in the leg or hand should not be neglected, and it should be investigated to rule out lymphedema, because now the lymphedema is curable.
Sir, it is a good sign that a disease, lymphedema, named is curable. My next question, we talked about symptoms, now causes of this particular disease.
In India, the most important and most prevalent cause is filariasis, which is caused by a bite of a mosquito, which is very prevalent in these areas which I just said, but all over the country as well. When these mosquitoes bite, their larvae, they get, and their adult worms, they get lodged in the lymphatic channels or those small pipe networks, and they obstruct the lymphatic flow because the lymphatics are damaged. So there is no propulsion of the fluid which happens, and there is a mechanical obstruction. So this causes the swelling to occur. The second most common is the cancers which are treated by the surgeries or radiotherapy. Now we all know, suppose this is the hand, there are glands in the axilla or there is a gland in the groin. We all have felt it somewhere or the other. So in the cancer surgery or the radiotherapy, these glands are either removed or they are burnt. So the gland is damaged, so the fluid does not go across and there is an obstruction. So this gives rise to the swelling of the limb. And this happens mostly common after breast cancer surgery and cancer of the cervix.
Previously also, as we were discussing, that this can happen in either ways. If a person is not suffering from breast cancer, normally also this exists.
Yeah, so there is a third cause, that is congenital, since birth. So sometimes it manifests at birth, sometimes the damage is small and it starts manifesting a little later.
Sir, at birth, if we talk about, it's due to some deficiency or?
Not exactly. It's a congenital abnormality in which there is a development.
Mosquitoes only?
No, that is a developmental issue.
Okay.
So like the channels are not very well developed.
So it can be cured as well if it's since birth?
Yes.
Sir, next question. Of course, as we were discussing that this is something related to a social cause, that's why we are here. Sir, what kind of a platform you going to provide if some sort of a patient comes to you, he's not having that affordable capacity? Is there some a framework or a platform or a planning?
So let me take this as a different way, this question. Now there are two types of treatment for this. One is a non-surgical treatment, which is equally important, and then there is a surgical treatment. Now before around 4-5 years, 6 years time, the surgical treatment was not available. Right. Now fortunately we are specializing in those complicated surgeries called lymphatic to venous bypass surgeries and some other complicated surgeries which are there. But the backbone of everything is a non-surgical treatment, which starts with massage, which is a specialized type of a massage, physiotherapy, and special type of bandaging. These have to be done even after surgery and before the surgery. So we have our plans in which we want to conduct first diagnosis camps where we are able to diagnose these, and we try to make it as affordable as possible, both in my center, and we are also trying to develop, and we appeal through you, through the NGOs and other philanthropic organizations, to start conducting camps for it, for identification and diagnosis of this disease, as well as the training module for the non-surgical treatment. Now these will take off the burden quite a bit. And then there are surgeries, and in the surgeries we will try to make it as affordable as possible. We are in the process of creating satellite network with specialized surgeons who are trained in this. So we are training a few people. We'll create a framework through which the surgical treatment can occur. But we have to realize that the surgical treatment can occur only in specialized centers because a microsurgical facility is required. But nonetheless, with the support of the government, the NGOs, and the hospitals, definitely we have schemes where the poor people are being handled even by the corporate hospitals. So we can work out a system in which the treatment can be made affordable and can be taken care of in a better way.
Sir, as our conversation was going on, and I had a brief myself on this particular disease before coming. So, taking every fact and studying every fact and analyzing every fact, what are your last words? Like, अब ये जो disease है एक तरीके का हवा नहीं है, it is curable and it is treatable, and without and it is an awareness for the and social cause rather than making it a other treatment proposal. So उस पे आपका कुछ कहना है from our channel?
करेक्ट. सो सबसे पहले मुझे ये कहना है कि जो अभी भ्रांति फैली हुई है कि हाथी पाँव ट्रीटेबल नहीं है, दैट हैज़ टू गो. Please understand that this is curable. Lymphedema is curable is one message which I want to pass through you and your colleagues and your channels, the media partners, is that lymphedema is curable. One must investigate. The second thing is one must investigate any swelling and find out whether it is lymphedema or not. There are many cases which can be tackled without surgery. That is the third point. Surgery is required, the subset of patients.
Sir, one last thing. If a person approached to you after seeing this, or if the affording capacity is not there, is the advice to him would be free?
Yes, any patient, not only those who are coming from this. If the patient is not affording, I don't mind giving the advice free, the investigations. Obviously, we'll try to get them at a concessional rate.
जब हिंदी में कहा जाता है हाथी पांव और हाथी हाथ, अब हाथी पांव और हाथी हाथ से छुटकारा जो है आपको जल्दी मिलेगा, और उसके लिए यू कैन कॉन्टैक्ट डॉक्टर अंशुमन मनस्वी और any doctor fraternity who is dealing in this particular disease.